Pituitary tumors are pretty common, but just because they are common doesn't mean that they should be shrugged off. Over time, these brain tumors can grow in size. They can cause pregnancy complications. They've been linked to decreased bone density and have also been linked to some serious vision problems. Pituitary tumors can actually grow, and when they grow, this can put pressure on the optic nerve. My prolactinoma is small. It measures about 3.5 millimeters. So at this size, it's considered a microadenoma. A microadenoma for me means that surgery isn't even the question. When I learned that it could grow, I knew I needed to start some sort of treatment. This is something I will have to monitor for the rest of my life. And at the start of my diagnosis, I was super reluctant about taking medication. I thought that the routine office visits and the brain scan and the MRI would be enough. And I knew I just didn't want to be on medication. I requested to see a different doctor at one point because I thought that they were pushing the meds too hard. Part of the monitoring process includes regular blood tests to test the level of prolactin in my blood. A normal range is between 4.8 and 23.3. When my test results jumped from 28.5 to 39.1, I knew I needed to start some sort of treatment. That treatment would likely include taking medication. After talking with my family, my husband, and my doctors, I decided that taking the prescription would be the best thing for me to do. I am currently taking a dopamine promoter called cabergoline. I take half of a tiny white pill 2 times each week. Cabergoline stops the brain from making and releasing the prolactin hormone, and it can be used to treat some menstrual problems, fertility problems, and pituitary prolactinomas. I've only been taking it for a short period of time, so it's really kind of early to see if it's working, and it's still new to me. For some reason, I've always had this hard time of explaining or narrowing down symptoms and side effects. So one of the reasons why I didn't want to take medication at the start was the obvious fact of I was on no medications and I didn't want to introduce something to my body if it was unnecessary. I also had 2 out of the 4 doctors that I saw, they recommended not to take this medication, that if I was feeling good and life was great, essentially, don't introduce this new medication because the side effects can give you fatigue or lightheadedness, and those side effects will just interrupt your daily life, and if you're good now, why take the medication? So, again, I've always had a really hard time explaining or narrowing down side effects. So, I've always had migraines for as long as I can remember. When I was diagnosed with adenomyosis last summer, I didn't know that the pain that I was experiencing was different than what other women experience when they have cramps or when they get their period. I thought that that was just normal and something that everyone experiences. So really narrowing it down is something that I struggle with, and it's hard for me to talk about things that might be hurting me or that might not feel quite right because I don't really have a good definition of what a normal feeling is. So I've only been taking cabergoline for a couple months or so, but one of the great things is I have noticed that my menstrual cycle is starting to become more regular. One of the questions that I have, which I am going to talk to my doctor about, is that this medication is typically only prescribed for 6 months. So for me, I'm really worried about next steps. What happens next? I will be meeting with my doctor again to discuss the details about the medication, and we will be doing more blood tests to monitor my prolactin levels, but the whole idea of what happens next is really kind of my number one question. When I was first prescribed cabergoline, I was talking to my doctor about fertility. So my husband and I want to have kids, may want to have kids, and having a prolactinoma can definitely impact fertility and pregnancy, and there's a whole lot of things to consider, but I'm definitely going to talk about that at a different time. But one of the things about cabergoline is that there is a medication that is similar to it that is actually safer for when you are trying to conceive or when you are pregnant. So that's just another question to bring to the table when I talk to my doctor on my next visit. Do I need to switch medications? I don't have any regrets about not starting the medication sooner. I am glad that I started it when I did. And I think for me, it was a personal decision that I needed to make that I didn't want a doctor to make for me. I needed to see the changes occurring within my body and not just take somebody's word for it. So I'm glad I'm taking the medication. The next steps are not so clear. Will I be on it for a longer period of time? Will I switch medications? It's still unclear at this point, but I'm really satisfied with where I'm at right now in my treatment. I'm going to continue talking about my experiences and life with the prolactinoma. You can read more on my blog at Fit Me Daily, and you can find me at Fit Me Daily on Instagram.